Assalamualaikum and good day everyone. My name is SARALYNA binti KAMARUDDIN and I will present to you my final year project, which the title is Heart Disease Patient Remote Monitoring System for Decision Making, Heartio-DSS. As for project background, I start by doing some research regarding the heart disease. Heart disease or cardiovascular disease (CVD) is known as the main cause of morbidity and mortality, or easy we call the cause of main death. It is important for doctors to obtain information remotely for conclude their decision making that include patient medicine, consultation, and etc. So this project idea is to develop a heart disease patient remote monitoring system for decision support in decision making. As for problem statement, traditional management performance that could lead to bias and misleading data that will affect the quality of service provided for a patient and could be affect doctor's decision making. That's for the purpose solution for this problem statement. A web-based system that created to monitor patients remotely, manage and classify patient historical data, display patient categorized data, and provide decision support features to assist doctors for better decision making. Next is project objective. The first objective is to classify biomedical data such as blood pressure, heart rate, oxygen, ECG and PPG from heart disease. The second objective is to create decision tree from biomedical data. The third objective is to develop a web-based system to integrate heart disease monitoring report. Then we go through architecture and module diagram. First is architecture diagram, which is in architecture diagram we have a three phase, which the first one is data collection, where data is obtained from patients' health devices and data history from hospital. Then the data will be collected and go through the second phase, which is data processing and communication, where the data is being measured in medical measure software and it will be sent to the cloud server, where in the cloud server admin will be involved in taking care for user entry. Where in third phase, which is storing and decision making, the data measure will be stored in database and it could be displayed in the system where doctor can view their patient record by viewing in the system. As for the module diagram, in this project we have 4 submodules. The first submodule is sign up and sign in. The second submodule is patient data. The third submodule is appointment. The fourth submodule is decision tree. Now we will go through my system demo. So firstly, this is the main page, which it have the sign in for doctor, patient, admin, also for get start. It will show the biomedical data technology. Now we go through sign in as a doctor. We need to log in, insert the username and the password, and then click on login. So this is the second main page or home page for user that log in as a doctor. So the features that have for doctor is attach file, patient help, decision maker, and appointment. So in the attach file, the doctor can add patient record file, which is the user need to click the choose file to add their data, which is the data need to be in CSV format, and then the user need to click import. The system will be showing the alert that file saved. Click OK, and then the system will be update and display the data that being added. Next, we have patient health, where in the patient health it will showing the record for overall patient, which it have the record date, the other breathing measure, for example like blood pressure, heart rate, ECG, oxygen, and etc. Next, we go to decision maker. In decision maker, we have decision tree and graph. First, we click on decision tree, and then the system will be display the patient list. The user need to click the name of the patient, and then the system will display the data click. For example, if user click on blood pressure button, the system will be display the decision tree of blood pressure. And then if user click the overall button, it will display the overall display of decision tree, which is have the heart rate, ECG, blood pressure, oxygen. Next, we go to the graph. The system will be display the graph list, and the user need to click patient name, and then the system will be display the graph data click. The user need to click the button. For example, if the user want to view the heart rate, the user need to click the heart rate button, and the system will be display the reading graph. Basically, the system will be showing if risk value is over than 100, but the normal value is less than 100. So basically, this reading will be showing based on patient record. If user want to view the overall graph, the user need to click the overall button, and the system will be showing the overall graph based on the color of the reading. For example, in the blue line, it has the reading record of blood pressure, while for the red line, it has the reading of heart rate record. Lastly, we will go to appointment. So basically, this is the display for the appointment. So if user want to add the appointment of the patient, they need to go through in the day, which in the day it has the timetable. The user need to enter which time that they want to add the appointment. For example, in 11 a.m. When they click in 11 a.m., the system will ask for enter the name. And then the system will be notified the user that the data is being added successfully. When you click OK, it has the name of the patient added. So if they want to delete the appointment, they can click on the name. So the system will be display the alert, and then you click OK. The system will be display the alert where the data is being removed, and then the data will be removed. Then we go through sign in as patient. So this is the second main page for user sign in as patient. The features that it have is health record, graph, and appointment. In health record, the system will be display patient health record based on user login. For example, this is the health record for Sophia Ariana. which is have the record date, the cholesterol, blood pressure, and etc. So second features is graph, and the graph it have features for blood pressure, ECG, heart rate, PPG, oxygen, and overall graph. So if the user click on blood pressure, the system will be display the reading graph of blood pressure, which is the reading graph is based on patient record. When the user click the overall graph, it will display the overall reading graph. As for the appointment, the user can view their appointment in the appointment feature, and then when they want to view the time for the appointment, they can view in week or in day. Lastly, we will go through login as admin. In the admin, we have the update profile. The admin can update profile for patient or doctor. So for example, we click on patient. The system will be display overall patient account. For example, like will be showing. If admin want to add one account, when the user click add, the system will be showing the data added successful, and then they can view the result, and then the system will be update the profile. If user want to edit the one of the profile account, they can click edit, and the system will be asked which they want to update. For example, I edit the username, click the update, the system will be show the update, which is the Cairo22 into Cairo123. If user want to delete one of the user account, they can click on delete, and then the system will be display the alert. When you click OK, the system will be update where the data is being deleted. The conclusion for this is the idea for this project was to help for making better decisions using decision support. And the second conclusion is the system could classify all biomedical data, include the blood pressure, heart rate, oxygen, ECG and PPG, and also to create a better decision making. That's all for me. Thank you.